What's the most difficult story you've covered during COVID-19?
There was a mother and son. She was in her 80s. I think the son was in his 60s. They were way out in Navajo Mountain, this really remote community. They had been treated and sent home because there's no cure and there's not much they can do. So they were out in this remote community. There was no way for them to get food and water, and they both died at home. It seemed like that really got a lot of response, and people started going out shopping for their elders, taking care of their elders, making sure they were okay. It's hard to see families suffering, and it's kind of a helpless feeling.
What challenges have you faced during COVID-19?
Well, we had a scare, you could say, early on where a non-native employee of our healthcare system did turn up positive very early on. Fortunately, they did not have much contact with other people. As soon as they felt unwell, they self-isolated. They found out, they were able to get tested. Fortunately, contact tracing, was followed up on, and there were no spread within the workplace.
The government is not real helpful about releasing statistics. For instance, they won't tell us exactly which community the cases are in. They're only giving us statistics by county. So it's hard. People want to know more, and we just don't have all the information, but we're doing our best. The IHS is only giving us the number of cases by county, and the counties out here are huge. I wish we could see more about what's happening in the hospitals. I'm hearing anecdotally that there are providers that are getting ill, that are feeling overwhelmed. But those are stories we're not really getting because they're IHS workers and they're not allowed to talk to the press.
What do you fear most about COVID-19?
Well, since this virus is targeting the elders, and as a Native person, how important the elders are to the community. They're the storehouse of the traditional stories, the herbs, the beliefs. And if we do lose too many more elders, I'm afraid it's going to affect the tribe as a whole.
Has the Trump administration stepped up to fully support the Seneca Nation during the pandemic?
I think it's it should just be very telling that during the negotiations around the stimulus package and legislation that many Republicans aligned with the Trump administration were trying to make the aid to Indian country be zero. And, they, I think, came with a middle figure between what NCAI was saying was a responsible and reasonable figure, and the Republicans' offer of zero. So, yeah, the reality is we are not as far ahead with prevention of something like this because government has not been acting responsibly at the federal level.
How are you distressing while you cover COVID-19?
Whenever I'm not crazy grinding, I do take little breaks during the day, and I split firewood for my wood stove, and I go out in the woods and I collect some food or some medicine, and get some spruce gum or get some wild ramps, wild leeks, and that stuff keeps me sane.
It's not easy. It gets depressing. Um, I notice the statistics, someone sends them to me usually between 6 and 9 p.m. and I find myself getting a little edgy, wondering how many new cases there are, and wondering how many more people have died, wondering if this is the day the curve's going to flatten. So far, it's just gone up and up. I guess my husband's here at home. He's a teacher, so he's working from home too. So we kind of, cheer each other up and go for walks with the dogs and anything we can do to kind of keep our spirits up. And I don't know if you've been to the Navajo Nation, but it's a gorgeous place. And all you have to do is just walk outside, and you're overwhelmed by the beauty of the Red Rock country and nature and spring coming. So I guess that's what's kept my spirits up, is just going out in nature and seeing, it's still all there. All the beauty is still all there, and it will survive this pandemic. It will survive this generation, and it'll survive humanity.